Hi, Dr. Deshawn. So I have a question about ADHD diagnosis. So my child is not jumping around and super active and super what I would consider hyper. So why is my child being diagnosed with ADHD?
I think that's a really good question. So ADHD has three presentation. One is called inattentive presentation. In attentive, in this type, the child struggle with paying attention, easily gets bored, forgetful, making careless mistakes, even in subject the child is really good at, having following direction, following multi-step commands. Parents need to have frequent reminders to make sure, the child is on task. Room is messy, it's very disorganized, and many times, the frustrating piece for the parents are these child can be hyper focused or really good focus in thing that they are interested in, like a video game, like arts, like something, but they may really struggle maybe in math, in science, or in any other social studies, depending on what subjects they found it boring.
Mhm.
And that sometimes parents may say is just the laziness, is just, and then there is no hyperactivity, there is no impulsivity, or there are very few. So this child have ADHD, but it is an inattentive presentation, and it's very common, especially in girls. And these children have been doing well because sometimes they have really good IQ, and that's why parents get confused that academically they are well, they are not being angry, irritable, hyperactive, jumping around. But when you talk to these stories, they have been misplacing things, forgetfulness, they get bored easily. They, even if the math is favorite subject, they may be making so many careless mistakes. And if we don't address it, it affects their self-esteem, especially when they go to high school, when they go to competitive schools, then they really struggle. So that's inattentive presentation. Then the child have hyperactive or impulsive presentation, where the child is having problems sitting still, with difficulty waiting for a turn, easily getting upset, fidgety all the time, and disrupting the class, blurting out answer, talkative, out of turn. So sometimes, if and they may not have significant inattentive symptoms, so they have ADHD hyperactive presentation. And sometimes the child have both, and that we call a combined presentation. So it's important for us to know that, even the child is getting good grades, the child can have ADHD. Even the child is not hyperactive, the child can have the ADHD. Even the child is not forgetful, not bored, but they can have the hyperactive presentation of ADHD.
Thank you so much for explaining that. It makes a lot more sense hearing you explain it and the different things that we can be on the lookout for. So I really appreciate your time.
Thank you for having me.